So today we start with how to code for types and places of service. There are a lot of types and places of service to code from the E&M section, and we will be focusing on critical care services and inpatient ICU or critical care for the pediatric and the neonate. And there's a difference between the two, and you will see as we follow along. So what exactly do we mean when we say critical care services? And you can see the code range given to you. It is 99291, 99292. Remember, every E&M code starts with 99 codes. There is also 991 in your medicine section, but there is a variation of the number starting with. So you have to make sure where these codes are starting. They're going to be 99, but there's going to be the third digit is going to be different. So when you go through them, you will eventually learn to see which one is from which section. So when we code from critical care services in E&M, we are always coding for the time given to the patient in the critical care services. And remember, when we say critical care services, it is basically done in the emergency room, because when the emergency room services fail to help the patient, the services that are trying to save a person's life becomes the critical care service, and it is only calculated as the time. No history, no exam, and no MDM is related here, whereas if you have seen my prior presentations, for emergency room we always calculate history, exam, and MDM. In critical care services, time is the only criteria for your E&M code for critical care service. The injuries or illnesses that the patient is being treated for is putting the patient at high risk. So if the treatment is not given here right now, the patient has a high risk of consequences that are not good. Organ system failure. If the patient is having some kind of organ failure, heart failure, kidney failure, liver failure, there is again the same consequences. The patient have a high risk of dying. Patient cannot be admitted at this time. So there is no way that you can say, okay, let's put this patient into ICU and we'll manage. No, the service, the treatment has to be given right here, right now. So this is how we judge critical care services. So let's do an example. Dr. Martin provided 1 hour and 50 minutes of critical care service to Jack, age 64, who's in the intensive care unit with acute respiratory distress syndrome. Now, do you see it? He's still in intensive care unit, but he's been given critical care services, right? And you have been given the time as well. So when you're reading these questions, you might get confused. Okay, this person is intensive care unit, but intensive care unit has its own code, which you will see. But right now, when they say given critical care services, that is exactly what you will code, no matter where the patient is, either in the emergency room or in the intensive care unit. So let's follow this example and see how we will find the code for this service. Remember, we always go to the index, and our main term is evaluation management in the index. The subterm is critical care, and we will find the code range 99291, 99292, only 2 codes for critical care. We come back to the tabular list. We will locate the codes on the right upper corner of each page, remember, and we will find these code ranges in the right pages of your tabular section. What keywords am I looking for? Only the time in minutes. And if you notice, there's a table posted on this page, and it's giving you a time limit and the codes chosen, the appropriate E&M codes chosen for this service dependent upon the time. So see if you can calculate this for me and give me the right code for the right time for this patient. Remember, the time is 1 hour and 50 minutes. Take your time, pause the video, come back to it in a few minutes. So here we go. Remember, it was 1 hour, 50 minutes. How many minutes are those? You break them down, and remember 1 hour, 60 minutes plus 50 minutes, it's going to give you 110 minutes, right? What's the code going to be as per the 110 minutes? Remember the table in your tabular section? Yes, it's going to be 99291, 9929 times 2. Times 2. This is part of your table right here, and you can see it is in between 105 to 134 minutes, right? You have to have your time converted into minutes to have a better concept of how many minutes am I calculating. Do not just put 1 and 50 together and make 51 minutes. Some students will do that. So make sure you are calculating all the minutes together, just taking a quick look on your table, and you have the answer right there. That is all you need. Okay, so we do have the correct answer, and make sure you go back, review it again to have a better concept. This is a very common question you will be seeing in your assignments, questions, CPC exam as well, and a very common relatable question that I want you to have a good hands-on practice. So what's the difference between neonate and pediatric, right? When we use these terminologies, and it's going to be a common terminologies, depending upon where you work. Remember, there's so many different specialities. This particular name that you're using you're probably going to be in the hospital or work for that particular specialty in a clinic or an office. So when you say neonate, it is less than 28 days. Pediatric is between 0 to 18 years. But you will also see some kind of breakdown between the 0 to 6 years of age. So the reason I'm showing you this is I want you to pay attention to these differences, terminologies. Make sure you know what these are. When we say neonate ICU, remember the neonate can be treated in the ICU and it is considered to be inpatient, in hospital, admitted. When you say critical care, this is part of the emergency room. Right? So you have to know where exactly the patient is to be able to correctly abstract the coding for this patient. Pediatric is also the same. If it says ICU, PICU, pediatric ICU, it's also inpatient, and critical care service is mostly happening in the emergency room. It can happen in ICU. You have to make sure judgmentally and judging it properly to see what kind of services are given and what criteria I have to choose according to the guidelines. When we code for pediatric or neonate critical care patient, usually not all hospitals have a pediatric or neonate ICU. So the patient, the pediatric, the baby or the neonate has to be transported to another hospital. So these are the codes that we use for the transportation and the supervision of the doctor that is going to accompany the patient, the baby, the neonate to another hospital because it's a baby. Anything can happen to the baby. So when the doctor accompanies the patient in the ambulance, we code for transportation, and these are the codes you will use. The patient is still being supervised by the doctor, so that those are additional codes we will be coding for the doctor. Let's review an example. Dr. Howard wanted her 18-month-old female patient transported to a facility that specialized in pediatric heart patients. Because of the age of the patient and the severity of the heart condition, Dr. Howard decided to accompany the baby in the ambulance to be sure she remained stable during the 1 hour 45 minutes drive. Now remember, we have to find the codes according to the terminologies given here in your index, in your tabular, and code for the transportation with doctor and the supervision with doctor. So here are the codes for transportation and supervision. You can pause the video, go back, review your index and tabular, and come back and confirm your answers here. The transportation codes are also dependent upon the time. As you can see, the first 30 to 74 minutes is 99466, and each additional 30 minutes would be 99467. When you go to supervision, again, the same situation. You have the first 30 minutes coded as 99485, and any additional 30 minutes coded for 99486. So remember, this is a very important part of your calculation, right? And I am not very good in calculation, so I have to make sure I understand, highlight, add, write down notes, however I can to know exactly how many minutes am I coding for each code. So make sure you have a good understanding of that. Remember, everything I'm teaching you has already been written down in your documentation, in your notes, in your guidelines within your CPT coding manual. So continue reading them, continue to highlight the words, because whenever you go to these different sections, you're not going to remember everything. But these highlights and notes and underlines that you create will give you a good understanding of, oh, I do understand, I do remember that these are the keywords for me in order to correctly code from this section. So here I am trying to show you the age difference for each patient in inpatient ICU or critical care services. So when the patient is less than 6 years of age, and if this hospital is referring the patient to another hospital, so they will only use the critical care codes 99291 and 99292. So if you are referring a patient from anywhere, ICU or critical care, you will only code for the critical care services. But if you are receiving that patient into your ICU, you are going to use ICU codes given here. If the patient is more than 6 years of age, remember these two codes that I told you are only for less than 6 years of age. More than 6 years of age, if the patient is anywhere, okay, even if he's in the referring or the receiving department, it is going to be critical care only. This is the codes for the neonates for being in the ICU and being in the initial and the continuing intensive care services. Initial means the first day. Continuing intensive care unit means subsequent, the next day onwards, because when you're in the hospital, there's a code for each day. So the second, third, fourth day is going to be your subsequent. The first day coding will be the initial, and it depends upon the patient's age and weight. So you can see the neonate is always less than 28. And the ICU codes for this patient, the neonate, is always going to be 99477 to 99480. It is also the age that matters here. Make sure you are keeping an eye on the limits of the weight given in your CPT coding manual, and be very conscious of what you are coding for. So remember, there are lots of keywords here, and you need to write these keywords down into your CPT coding manual under these codes. That will help you a lot in remembering everything. This is a quick review of the patient's subsequent ICU, and you can see how they have broken it down into different weight of the neonate. Let's do a quick overview of another example. Remember, this patient is going to be taken from the ER to PICU, Pediatric Intensive Care Unit. It's the same hospital, so you're not moving one patient to another hospital. You're moving the same patient from the same ER to the same hospital's PICU, so you will always code for the PICU, not for the emergency room. So if you read the scenario, you will see that the patient is being taken from the emergency room of the same hospital to the PICU of the same hospital, and we need to know the age of the patient. We don't know if we're going to use the history exam and MDM, but we will read the guidelines for it. So as you can see, we have a code 99475, and it says initial inpatient pediatric critical care, gives you the age 2 through 5 years of age. And remember, our kid was 3-year-old. So we know that our keywords are matching here because it's not a neonate. Neonate is less than 28. We have a pediatric care unit code, which is for the 3-year-old, and this is the right code. So make sure you're pausing this video and finding these details in your book and writing down the keywords right next to the code. I have posted the rationale for this answer for you. You can pause, read, and follow this scenario better with a good concept. I have posted some more questions to review and help you understand the concept, because the more we practice the questions, the more we understand. Make sure you review these questions by pausing your video for a few minutes, going back into your book and following the steps as often as you can. So remember, what did we learn here? Critical care services, ICU critical care for pediatric and neonates. Now remember, if you have any questions, do not hesitate to touch base with us as soon as possible. I hope you have a great day and happy coding.